So the next category is obesity. So a bit about the issue. Childhood obesity has become a crisis from conception to adulthood, and it shows no sign of retreating. Vous l'avez entendu, Max, tout à l'heure, en fait, en a parlé pendant son allocution. L'obésité chez les enfants depuis la conception jusqu'à l'âge adulte est passée à l'état de crise et ne montre aucun signe de déclin. Hospitals like CHEO are seeing more and more children and youth who are obese and seeing related health issues that are more and more serious. The demand for treatment is exceeding our ability to provide care and challenging the methods of care traditionally provided. A bit about the WINNING program. The WINNING program works with kids aged 6 to 18 years in Stormont, Dundas, Glengarry, and Prescott Russell, helping to improve their eating habits and increase their physical activity daily. The program has implemented a whole school approach, including staff, parents, students, and community members. Schools have developed action plans targeting improved healthy environments and policies. New after-school programming was launched, as were 4 green box food projects and a new municipal policy, all designed to support healthier lifestyle choices for children and their families. So congratulations to ENERGIZE, a program from the Eastern Ontario Health Unit. You have made a difference.
It's with great pleasure that we accept this award. Actually, I'm accepting on behalf of our ENERGIZE team. The Centaur Health Unit represents, as you said, Stormont, Dundas, Glengarry, and Prescott Russell, the eastern counties, and it gives us an opportunity to sensitize people that there are also outreach programs that CHEO does, and beyond what Max was talking about, into the eastern counties and Renfrew and all the other Champlain area as well. And that's very important to keep in mind, that yes, Ottawa benefits, but so do the eastern counties, and we're very appreciative of that as well. In terms of the program that we've put together, actually, I'm not taking credit for it. I inherited the program. It was really started by Louise Simmons and her team. It was in response really to striking measurements that we did in grade 2 students, actually, in 2005, 2006, that showed almost 35% of the population, pediatric population, was either overweight or obese. And that's among the highest rates in Ontario, higher than the Ottawa average and higher than the Canadian average. And we thought that basically we needed to do something about it. And I'm just going to plug public health for a second, and I'll talk to you about what public health is. Public health is ceci qu'on fait en communauté pour gérer et améliorer la santé de la population. What we do together as a community, to ensure the health and wellness of the population that we serve. We're practicing public health today. CHEO practices public health. We all practice public health. In that spirit, we basically work with communities, schools, recognizing that it's really a community that will help these children. There are reasons beyond one's control sometimes that obesity occurs, societal reasons, and I can sit here for 2 hours and give you a lecture on what causes childhood obesity. But suffice it to say that it is a combination of many factors, socioeconomic factors, poverty, lack of resources, lack of proximity to healthcare services, lack of proximity to recreation services. And with this community model that ENERGIZE has established, we're able to reach out to the community to do 2 things. One, sensitize the population that this problem exists. And as Max said, the first time that this generation will outlive their kids, which is a tragedy in the making. And secondly, what we can do together as a community. I was struck, and I'll tell you a story. When I first started at the Centaur Health Unit in 2000, and I forgot the date now, 4 years ago, we launched the ENERGIZE program. And in the audience, we had a community-based program in Cornwall. I gave the talk on obesity and what the ENERGIZE program was. And there was a lady who basically got up and said that, you know what, it'd be great if my kids could benefit from the great pool that we have here locally. But it costs a lot of money. You know, I can't afford the daily rates for my child to go swimming at the local pool. Cornwall has a beautiful aquatic center. And within the day or so, I got a phone call from City Hall. The mayor was there, some other people from the recreation center were there, and actually said that, you know, we listened to that lady, and there's a barrier for the children getting exercise, and now they released a daily free swim program now in Cornwall. Just to give an example of how these things work. So it's a community working together. We're working together for our kids. And again, I appreciate the acknowledgement that we get with this program. And it actually sheds light to the fact that CHEO serves an area beyond Ottawa, the eastern counties and the whole of Champlain area. And we're grateful for CHEO. We collaborate with CHEO. And I'm a pediatrician as well. So I really understand where things are coming from when we talk about care and the love behind the care that we give to our kids collectively, which makes a difference for the future. Merci beaucoup.
The selection committee that reviewed all the applications was especially taken with our next program. So taken, in fact, they recommended to the advocacy committee that we create a special award, which we call the Teddy Bear Award, or we also affectionately call it the Fuzzy Bear Award. And we created this. And when you hear me describe the program, and when you meet the participants who've been very patient, great speech, Michelle, Joanne, but very patient, you'll understand why we felt it was indeed worthy of a new and special award. Walk This Way is a program inspired by the life of Dr. Sean Egan, a professor of human kinetics at the University of Ottawa, who passed away at the age of 66 while attempting to summit Mount Everest. A great model for us all, not the finality of it all, but obviously a man very committed to exercise. He brought a focus to the disturbing trend of sedentary living and poor diets among Canadian children. Walk This Way challenges inactive children and youth aged 8 to 18 to do something they probably never dreamed of: to register for and complete an event in the Ottawa Race Weekend. In 2010, this walking training program targeted children who faced barriers to eating well and participating in sports and other dance activities. With the staff of volunteers, t-shirts and registration fees were covered. 25 children crossed the finish line in 2, 5, and 10K events. Very impressive. Now we have about 7 or 8 of these remarkable kids here today, and in fact, they walked from the Boys and Girls Club here tonight to receive their awards. How many kilometers is that? 5. 5 kilometers. It's worth it. Honest, it's worth it. This program is also about empowerment, leadership, and about leveraging self-esteem and community building. And it truly commands our honor and admiration. I'd like to ask Gavin Lumsden, who I chatted with earlier. His parents are here. It's very nice. Gavin to come forward with his entourage, who joined him, walked over. Gavin, did you walk as well? Just checking. So kids, if you want to come up too, please.
Well, thanks very much, Sean, and thank you all very much for honoring these young people for their outstanding achievement. I feel like I should start by conceding that there's considerable irony in receiving recognition from CHEO. That is because when we first launched the Walk This Way, I distinctly recall telling parents of potential participants that our goal was to put hospitals out of business. Obviously, that's a bit of a lofty goal, and no doubt we will always need hospitals to help us with the many insidious diseases which continue to confound modern medicine. Indeed, as Max mentioned, we are very lucky to have CHEO in our community, an institution of provincial, national, and even international repute for the truly outstanding quality of care it affords each and every patient, each and every day. But as my mentor and friend Sean Egan counseled nearly 5.5 years ago, we need to invest more resources in prevention so that we won't need to spend so much on reactionary medicine. We need fewer pills, medicines, and surgeries, and to do that, we need people, and most especially young people, to embrace healthy, active lifestyles and nutritious diets. This is what Dr. Egan taught me in 2005, shortly before he passed away on the slopes of Mount Everest, while trying at 63, as Don mentioned, to become the eldest Canadian to reach the summit. And it is his counsel that is the inspiration for Walk This Way. Sean would be thrilled to learn of CHEO's Let's Keep Kids Out of Hospital Award. It's fitting that the award should be conferred by CHEO, for not only do they save, restore, and rejuvenate the lives of young people day in, day out, but their research staff, including Dr. Tremblay and Dr. Hadjianakis at the HALO team that Max mentioned, are doing groundbreaking work that not only leverages public awareness, but offers solutions and strategies for high-risk children so that we can, in fact, keep kids out of hospital. We, and by we, I refer to all of us, Judy Thompson, who is a volunteer who is here today, Wendy Gifford, who you'll remember walked with us and who is right now in Alaska somewhere running a race, Mango, our mascot dog, but also the staff from the Boys and Girls Club, Shannon and Abby, who walk with our group every single Saturday morning, and Adam Joyner, the McCannon Clubhouse manager, and Jared DeFazio, the director of programs. So we are all really, really thrilled with the results of this program. Walk This Way was launched 4 years ago at the Y, actually, as an extension of their Kids Fit program. This year we migrated it to the Boys and Girls Club so that we could expand participation to the young people who might benefit most. And what a terrific partner the Boys and Girls Club has proved to be. I can't thank them enough for their energy and enthusiasm that they've invested. Needless to say, we're most proud of the Walk This Way participants who are here today. Most of them are not speaking to me right now because I asked them to walk here. But guys, please know that that what you have accomplished is really amazing. You have been an inspiration to Judy, Shannon, Abby, and I, but also to countless others, as you achieved what you thought you might not have been able to. So we hope you remember that, and each time you look down at your shiny medal that you won at the race weekend, that you're capable of doing pretty much anything you set your mind to. I also want to take a quick moment to thank the Ottawa Senators and the Bell Capital Cup. They were very generous in sponsoring our t-shirts and our shoes and our bus tickets so we could do some special walks around the city. Also, the Ottawa Race Weekend, who provided entries so that all the kids could participate in the 10K. We're very, very grateful to the Jim Robinson, the general manager there, and all of their staff. So, what's next? Well, we've begun preparing for a new season of Walk This Way to be launched in March of 2011. We plan to expand the program from 25 to 40 participants and welcome young people from communities all around the city. We have secured some excellent new partners, including the National Arts Centre, who have agreed to help us create some very exciting educational experiences for Walk This Way. So, on behalf of all of us, thank you very much for honoring this program with this prestigious award. We see it as crucial that CHEO is providing important leadership in the drive to reverse sedentary lifestyle, sedentary living, and poor nutrition. And so, after we finish wiping the cupcakes off our lips this evening, we promise to do our very best to pay it forward.